So yet again, you've had a poor night's sleep with multiple awakenings during the night, and you're feeling drained and exhausted the next day. But what is it that wakes you up during the night? There are likely to be many reasons. It could be medications, could be the sign of a clinical sleep disorder, physiological changes, psychological concerns, or other environmental factors. But how can you determine the cause? Well, let's give you a few tools to help identify what's going on. Firstly, think about what medications you might be taking for other health problems. Many medications list difficulty with sleep or daytime sleepiness as one of the known side effects. So have a think about whether these are likely to account for your sleepiness or disrupted sleep. Secondly, talk to your bed partner if you have one. Often we're not aware of our nighttime behaviour, and reports from a bed partner are perhaps the only source of information for what's going on in our nocturnal world. Ask them whether they hear you snoring loudly, gasping for air, or choking frequently during the night. This could be the sign of a sleep-related breathing disorder called sleep apnea. Quite often, patients with sleep apnea are totally unaware of their frequent gasping for air during the night, but simply experience extreme daytime sleepiness. So identifying this as a potential cause is important. There are well-developed treatments for sleep-related breathing disorders, so go to your GP if this sounds like a potential cause for your sleepiness. Additionally, you could ask your partner if you kick your arms and legs frequently during the night, and if you have the experience of creepy crawly feelings in your legs before bedtime. This could indicate the presence of restless leg syndrome, or when it happens during sleep, periodic limb movements of sleep. Again, there are known treatments for such difficulties, but these symptoms are often difficult to notice on your own. But if you do sleep alone, maybe take a look at the state of your duvet or bedclothes the next morning. Are they all over the place, strewn across the bed? This could indicate that your limbs are flailing around during the night. Thirdly, look out for patterns in the timing of your nighttime awakenings. Do they always occur at the same time each night? Or is it always in the first or the second half of the night? The first half of the night is rich in slow wave sleep, and there are a group of sleep disorders that are known to arise from this sleep stage, such as sleepwalking, sleep talking, or night terrors. Similarly, the second half of the night is rich in rapid eye movement sleep. And again, there are some sleep disorders that present specifically during this sleep stage, such as sleep paralysis, where you feel awake but you cannot move a muscle, or REM sleep behaviour disorder, where individuals physically act out their dreams. Perhaps keep a diary to keep track of the time of your awakening and observe how you feel when you awaken. Is your heart racing? Are your palms sweaty? Are you feeling frightened? Do you feel confused by your surroundings? If so, this could indicate you may be having a sleep terror. If any of these symptoms mentioned sound familiar to you, you should probably go and speak to your GP and ask for a referral to a sleep expert to see if there's an underlying clinical sleep disorder that requires clinical attention. If this doesn't apply to you and you just suffer from the occasional night waking, then follow the videos coming up for some tips on how to manage different types of night awakening, such as those arising from physiological changes, psychological concerns, or environmental factors.